Welcome to the Good podcast. I'm your host, Dee Talley, mama, licensed acupuncturist, herbalist, and embodiment coach. Here we dive deep into the realms of energy, consciousness, awareness, empowerment, and personal transformation to help you create a more vibrant and juicy life. Hey everyone, thank you so much for joining me. I'm Dee Talley and this is the Good podcast. I am so excited today. So today we have on my business partner and friend. She is a licensed psychotherapist who runs an amazing practice, and we share office space in downtown Plattsburgh. Her practice is called Ember and Root Modern Therapy and Counseling.
Yep.
I feel like I
nailed it.
Welcome, Anna Dickson.
Yay!
Oh my
so
God.
happy to be here.
You know what? When I was doing season 2, like I was plotting and planning, I was like, you're the number one person that I need. I need you.
Oh my God. I was like secretly hoping you would ask me to interview too, because I'm a fangirl of Good.
Oh, thank you.
Yes.
Yay.
So I'm just really happy to be here.
Yeah, thank you.
We're doing it. We're
That's
really
awesome.
doing it, Dee.
I know. We are doing it.
We actually have this metaphor that we're like two separate rocket ships that are like going to the same planet,
Yep.
and we're just ascending as we move through this together.
Hell yeah, we are. Yeah.
Our husbands think it's super weird, but it makes perfect sense to us.
They love hanging out with us when we talk about it. I like to start out the good by asking you, what is your good? And if you need me to elaborate on that.
Let's elaborate on that.
Okay. When I say what is your good, I am saying what is the sense felt shit that you can't buy online that lights you the fuck up?
Anything that is sensory stimulating, but in a way that creates a level of elevation for me and also a sense of calm. So it's kind of enlightening both the mind and the body.
Can you give us examples?
Oh my gosh. My first and foremost is a solid cup of hot tea in the afternoon when my kids are having quiet time. And I am able to then light some incense or some essential oils, listening to good music. And basically, it just enhances my present moment. And it's super grounding. As a mom to small children, I feel like I am constantly in either a mental or physical state of rush, right? You talked about that in a previous episode. And that is so real. And I find that I have to consistently train my body to not when time allows.
Yeah, like rush too, for me, what I noticed is it's not always like people on the outside might not even see it. It's like a quality of energy.
Exactly.
Like inside of our systems that is like,
it's just
get to the next thing.
Yes.
It's like it's vibrating too high.
Exactly.
Yeah.
Exactly. And so anytime I can engage my spiritual essence as well as my roots, that to me is a quality sensory experience. And that is my good these days.
When you're talking about that, I'm like seeing the Ember and Root logo.
Oh my gosh.
Because when you said like my roots and elevating, I'm like, okay, flame, like roots.
I didn't even put that together, but that is spot on. Yep. Spot on, D. There we go. Look it up, gangsters.
Okay. So give us the story of you finding your way as a psychotherapist. Like, was that something you were like, oh, I'm a young child and that's what I want to do with my life? Or was that something that kind of transpired throughout your life?
Yeah, I really thought about this because it's multi-tiered for sure. It's a journey. So it started out when I was really little. My mother, she'll say it to this day, that I had an innate curiosity for human nature. I just naturally observed people. I observed how they acted, how they interacted, and I interwove their life story into what their current behavior was telling the world.
Like you could see that at that age.
Throughout my childhood.
Whoa.
So my mom would ask kind of like, not ask, but she would, we'd bring up certain topics and rhetorical questions, kind of like unanswered psycho-based questions about life or about a group of people or about, topical news, events happening. And I would just answer those questions as if I just knew it like fact. This happened because these things happened prior. And because of that, this is what's happening now. And I could do it for a human, a single human, or I could do it for a group of people. And I always just thought that that was normal. I thought everyone thought that way.
Such a gift.
And my parents were like, no, that's different.
Nope.
Yep. Consequently, as that was happening, in and around that time, I actually started, maybe I could always feel energy. So what's interesting about that is I, again, thought that that was very normal. I thought that I was able to, like everybody else, just sense people around me, their energy output, and I could use it to inform my interactions with them, whether it be as a child with adults, whether it be with peers, whether it be with superiors like teachers or coaches, things like that. I always just utilized this energy output from other people to inform how I would interact with them. And it would breed a level of success and rapport and connection that allowed me to move through this world in what I know now is a pretty unique way. But I always thought I was just same.
Yeah.
That's just what people did.
Wow.
And I didn't put any of that together until I went to grad school. And I started getting feedback from my cohort that the things that I was saying in sessions, because you record sessions, you know, you get feedback, you play them. The things I was saying in sessions were not at all something that the client was giving me or what they were giving me when we were doing role plays. So for example, there was one time when I was doing reflections. And for those that don't know, reflection is a micro skill in psychotherapy that allows a client to go deeper. Basically what happens is you paraphrase or you directly repeat back to somebody what it is they're saying. And when you do that, it allows somebody to feel very validated and it allows them to make further connections with their own pathways and their own experience. So that being said, we were practicing that one day. Afterwards, one of my cohort members, the student, came up to me and said, what did you do right there? And I said, reflection. I was just doing reflection. And they said, no, you didn't. You didn't repeat back to me what I said. You repeated back to me what you heard me say. And he said, those are two very different things.
Whoa.
Mm-hmm. And he said, that's what I was thinking. It's not what I said. And because of that, I started to realize that I was different from the very people that were studying the exact same thing as me. So that really started to help me realize that I was different, that what I hear people say is actually not what they say. It's an inner experience that I actually have almost like an antenna to pick up on and repeat back.
I can see you getting emotional.
Yeah.
Tell me why, or like what this touches in you.
I am just so passionate about what I do. It is just, it's my heartbeat.
Ooh, chills.
Yeah.
Yes. Wow.
Yeah, I love what I do. And I feel very connected when I talk about it.
Yeah.
I feel
yes.
I feel this.
Yeah.
Right?
Yeah.
Huge. So then I started feeling around that same time, it was my first or second year of grad school. And my grad program was 3 years. I started seeing energy, not just feeling it. And so what was fascinating about that was it actually scared me. I started seeing auras. Yeah, you're nodding your head like you know.
Yeah.
It just turned on one day and I was concerned. I was concerned for them. I was like delving out free advice at that point. And
concerned for you.
Yeah.
You were like,
yeah. I saw someone talking. She was a religious woman and a coworker. By the way, I worked a regular job while I got through grad school. It helped me pay for it. So I was doing that while going to grad school full time. And she was a religious woman. I lived in Utah at the time. I went to University of Utah for graduate school. So there's a large Mormon population there. And she was talking about her grandkids. And all of a sudden, she just lights up purple. so bright. Her hands, purple was dancing around her hands, her neck, her head. And I was like looking at her and I was thinking, you need help, ma'am. You need help, or I need help.
Or both.
Or both. I was so freaked out.
Yeah.
I went home. And the thing is I knew about auras at that point. I knew about energy, but it never applied to me. It was never like, you have that.
Yeah.
And so I did a bunch of research and all that showed up was just auras. That's an aura. Purple means a connection to the spiritual.
I was going to say, do you interpret the colors as, like, have you looked up the colors, or is it something that you feel like you can interpret?
On the spot.
On the spot.
I
Okay.
do. I interpret it on the spot.
Okay.
I know the general gist of the aura, but depending on the work that I do in session and the shift of the color of the aura, it deeply informs what their internal shift was in that moment. Yeah. And the coolest thing about it is that when clients have unburdened either the majority or all of their trauma, their auras burn white. Ooh. They glow. It's like a level of purity
so much sense.
that is
unmatched.
Undeniable. Yeah. It's undeniable in session. And they feel it. They always say this. I have this glow around me. At the end of, like, when I know they're close to graduating. They have this glow about them. And it is something that I see too. It's pretty amazing. There's like this level of purity, like fully unburdened, fully authenticated, fully realized. It's amazing.
Yeah.
Yes. So I realized that was happening. And I made this choice. It was a very conscious choice. I said, again, I'm going to get emotional. I said, I can either turn this on and be unafraid of it, or I can turn it off. It's my choice. And I said, I'm going to turn the lights fully on inside my body and just see what happens. And it's been an instrumental piece of my work since.
I love hearing you talk about it because, like, I know a lot about your energetic gifts, but I don't I'm really glad that you're telling us all of this.
Yes, the specifics of it. Oh, yeah. Yeah. So we'll probably get a little bit into the type of therapy that I do.
Yeah.
But when it comes to a certain piece of my therapy, internal family systems therapy, this energetic sense that I have has allowed me to see parts. It's allowed me to understand parts. It's allowed me to hear them. And it really deepens not only my practice, but my clients' ability to resolve their trauma.
Okay, I want to pause you for a second because I want to keep hearing your story. But for people who don't know what parts are.
Parts. We all have parts inside of us. It's like a little family of parts. Internal family systems therapy. And basically what it does is it acknowledges that we have a bunch of sub-personalities inside our body that can either, when traumatized, work against each other, or when fully unburdened and operating at the highest level, work together and symbiotically.
Yeah.
Like a team.
Is it true that parts are created when trauma occurs? Or are parts created, like, are you born with a ton of parts? Or do you just, like, does the system create the parts for protection or for helping? How does that work?
That's a great question. It depends on how early the traumatic events are. We are born with a system of parts, but these parts by nature operate symbiotically right in the beginning. They operate together. They are a small team.
Yeah.
The parts, because of, just how underdeveloped we are in infancy, are fairly simplistic. That's with the idea that there's no trauma happening in that moment. By the way, trauma is universal because suffering is universal. How we move through it and our previous life experiences will be the roadmap for how we are able to either spontaneously rid ourselves of the current trauma or unburden it, or how we hold it in our bodies. So that being said, when we're born in infancy, the idea is that we're born pretty much perfect. So there's a strong sense of self, and there's a small system of parts that when we need certain things, we can communicate them to the proper parties, our primary attachment figures or our caretakers, and our needs are met. Okay? As we get older and as we develop, primarily through puberty, what can happen is we can actually get Well, we do. We get new parts based on new emotions, new experiences, right? And based on our experiences, our emotions are defined based on those experiences, right? Mm-hmm. We can develop parts that are either in pain and reactive and scared, or we can develop really healthy, developmentally typical parts. Mm-hmm. Okay. Again, our environmental factors really define what those look like. Mm-hmm. Okay. So that being said, our family grows and grows and grows. And depending on what these environmental factors are, our family can grow big and comfortable and safe and communicative like a team, mm-hmm. or they can become dysfunctional.
Mm-hmm. You know, what always fascinates me about parts is, because I know about this because this is the way that my own therapist practices with EMDR and parts work together. Mm-hmm. What always fascinates me is how parts don't always know about each other.
Oh my gosh. No.
And
great point.
How magical is it when those parts meet?
Oh my gosh.
Right? Because like what causes us to not know each part? It's like is it our inability to see? Or is it our lack of connection?
It's all of those things. Mm-hmm. It's all of those things. So what can happen is parts of our system can get exiled. And
these are the in-pain parts.
Yes, okay. The in-pain parts.
Yeah.
The parts that hold the trauma memories, mm-hmm. the parts that hold the suffering. They get exiled. Why? Because the system turns on them because they associate that part with the traumatic event. Ah. And so it's really important that we identify and we find those parts that are really, really far away, and we resolve their trauma. Mm-hmm. And after that, all of these other parts can see and look at that part for the first time without feeling fear, mm-hmm. and integrate them into the actual family structure.
Yeah.
It's like being punished. For example, God forbid, in childhood, when we're punished, we're exiled to either our rooms or to a scary part of the house for an indefinite amount of time, mm-hmm. right? Mm-hmm. We're going to start to feel ugly ourselves. We're going to start to feel very bad if we associate our own behavior with this disproportionate and severe punishment. Mm-hmm. Mm-hmm. When that happens, there's a small part of us inside that gets exiled too. Mm-hmm.
Mm-hmm. And so there's big self that runs the system.
Yes, for IFS, yes, there's a big self, the idea is. Yes.
Okay.
There's other therapies to get real nerdy. There's other ego state therapies where you don't actually use self, mm-hmm. because self can actually be exiled as well, or it can be so underdeveloped that self is not an adult in the system that can actually provide a level of support needed. I use that at times. I don't need self to do really good work with my clients. Yeah. Because sometimes their trauma, depending on when the trauma happened, early infancy, through childhood, or the severity of trauma, self actually can remain underdeveloped within the system. But in IFS, yes, the idea is self is the be all end all, caretaker, nurturer, empathic leader of the system. Mm-hmm. Yes.
So I have two different things to say. The first one is, so in Chinese medicine, there is a diagnosis called congenital essence deficiency. And what that means is from birth, we don't get what would be considered like typical amount of like essence. In Chinese medicine, that means like kind of genetic material. It makes me think about like people who aren't born with parts. Like you said that we should have these parts from birth. Mm-hmm. Like what happens if somebody through generational trauma, this is a monster question, through generational trauma.
It's quite simple.
Cool. Yeah. Who like don't have those parts. Can you actually develop those parts through this work?
In theory, yes. Yes. Okay, this is a monster question. You did. You snuck it in right at the end. I can't remember exactly what the diagnosis was for acu that you just said.
Mm-hmm. Congenital essence deficiency.
Okay, yeah, that's basically self-deficiency.
Totally.
So I would equate that to extensive trauma history in
familial.
Infancy. Yes.
Okay. Yeah.
Yes.
Yeah.
in infancy or prior to 18 months. So the prior to 18 months attachment is crucial to proper and healthy development. Infancy, also in utero trauma is a thing too. So depending on what mom experienced, depending on what her environmental factors were, there can be some in utero trauma that the baby digests and is then emotionally malnourished.
That is fascinating. That fascinates me.
And I work back into in utero trauma.
You can work back.
Yep.
Yeah.
Yep.
Whoa.
Done it all.
That's like...
Yep. So where it gets complicated, Dee, is that the client has to believe that they can heal.
Yeah. Oh,
And
we talk about this ad nauseum on this
I know.
podcast.
For real.
And in life.
I just can't even explain how critical and crucial that is. But with someone with that extensive of a trauma history, it's very difficult to keep them in treatment. They are fearful of any sort of attachment.
Right. That makes sense.
So the closer you get, the scarier they get.
Right.
And so treatment can be, it can be at a very slow pace. And I don't mean that in a judgmental way. Yeah. I mean that in just a way that states the nature of what my work is with people like that. They also don't believe they can heal because they came out of the womb in pain.
Right.
So if pain is all they know, to detach from said pain is very difficult for them. So again, buy-in is hugely important, and treatment is fairly long-term for them.
Yeah.
And also, I believe that anyone can heal.
Me too.
Just like everything I do, the way I view it is like a broken arm. Yeah. Sometimes it's actually stage 4 cancer. When we catch it is really important.
So in Chinese, I have the other question too, but I'm just going to let that one kind of marinate for a second. So in Chinese medicine, there's this correlation between like, if you've had the condition for a length of time, typically the treatment is at least that length of time. What fascinates me about EMDR and IFS work is it can be pretty quick.
Yeah.
Like in terms of resolution of trauma. What are your thoughts on that? It can be quick. Like you guys do, like you and the clients do huge work in 50 minutes, an hour.
Yeah.
And it's amazing.
Yeah. They come out different.
Yeah.
Yeah. It's really cool. That I love how fast paced this work is.
Yeah.
Interestingly though, and what a lot of people don't know, and even people that work in trauma don't know, is that the foundation prior to EMDR is so important.
Yeah.
And I am doing so much groundwork ahead of time to solidify their system and get their system. When I say system, I mean IFS, their internal family system, to a place where they can actually go and look back at the trauma.
Assimilate.
Yes.
Feel safe, walk out of the room and not flip.
Yes.
Or maybe flip, but
yes,
like have tools to.
Yes. And what's interesting too is if you don't do enough internal family systems work ahead of time, there might be a scared part that's watching this whole thing and re-traumatized while another part does the work.
Wow.
Yeah. So there's tons of groundwork that can be done ahead of time so that when you actually do EMDR, it can literally be done in like 3 sessions.
Gosh, I feel like you do mental gymnastics in there. It's like amazing.
I love it
feel
so
like
much.
you run like mental circles.
Yeah.
Is how I see it.
So what's interesting
amazing.
is that's where my energy, my
it fuels you.
energy sense, it fuels me, and it also guides me. Like I'm just talking to parts and I'm doing things with certain parts that clients aren't even aware of.
Right.
To get them into a place where then I can do work with this other part.
Yeah.
So there's a lot of, it's a multi-step it's multi-tiers. There's a lot of stuff happening simultaneously on the days when my energy levels are fully turned on.
Yeah.
Right. And
it makes so much sense that your energy would inform
huge
that work. Yeah.
Yeah. It really helps for me to see those parts.
Yeah.
And to almost intercept them before they flood in therapy. And when I say flood, it means they just completely hijack the system. So think about anyone that is a parent or has been a caretaker in their life. I hope everyone has had that opportunity. Why? Because it takes a village gang. Anytime you caretake, even when you are not related, that is important work. So thank you all for doing that. I know all of you have probably done that at some point. Think of it as like a small child just scream crying, and you are trying to run the most important business meeting of your life.
Yeah.
That's what happens.
Parts get when the parts get hijacked. Yeah.
And that cannot happen in an EMDR session. It will completely hijack the client will feel like they can't get any work done. They will also feel like a failure, as if they're not producing what they need to. And so all of these things are very important for when EMDR actually happens. It can be a seamless process for them. Yeah. And it's actually beautiful. Like when you actually set it up perfectly,
symphony.
when you tee it up, it is. When you tee it up, I mean, clients are like, they feel so much better.
Wow. That is like so satisfying even to hear.
Oh, it is. Yeah. Yeah. You even said too, Dee always says that she knows clients did good work in session that week because the whites of their eyes are brighter.
Yeah, like their Shen totally changes.
Yeah.
And just the way that their body functions is just so much more ideal.
Yes.
So my next question that's been kind of marinating is, so I'll just speak from my own experience. When I first started IFS work, I felt crazy. Because what you're saying is there's multiple kind of personalities inside of you. And when you start to kind of peel those apart, it feels nuts.
Yeah.
Now that
it feels nuts because it feels so real. Let's like be honest about that. Yeah.
Exactly.
Because you're like, what was that?
And then you can, I was like, okay, do I have split personalities?
Right.
Like what's going on here?
I've been asked that question hundreds of times in my work.
Yeah. Like, do I have split personalities? Yeah.
At the end of it, because it's so real and it shifts their mood so fast.
Yes.
And it realigns their chakras. It realigns their body
energetic system
so quickly.
Yeah. We talk a lot about, and in my work and in the podcast, about imaginal work and how important it is to be in your body and to use your imagination in terms of like integrating. Do you feel like that helps people do you think that makes them feel more crazy or less crazy?
To use their imagination?
Yeah. Like for people, especially for people who like aren't connected to that portion of themselves.
Well,
like,
what's interesting
it can feel
is
nuts.
if they lack imagination, that tells me exactly where their trauma started.
Young.
Yeah. Imaginative play is critical to development in late toddler stage as well as young childhood, right? So that actually informs me exactly where their trauma started and atypical development in terms of emotional development started.
Yeah. Do you think it's hard for clients to use their imagination in therapy work?
Again, it depends on the nature of their trauma and when it started.
Yeah, that makes sense.
So a lot of clients, it's so interesting because some clients that are largely dissociative have a really good imagination because their systems can go places and escape to places that no one has ever had to do before outside of their own personal experience with their trauma.
Yeah.
And then there's other times where the system is so deteriorated and disintegrated is a term we use when all the parts are just flailing around. Nobody knows who they are. Nobody knows they're in a family. It's like they're in a super dark house. All the lights are off and all they can hear are each other's crying.
Oh my God. Yep. That feels like visceral.
Yeah. That's how a system works.
And how much suffering, right?
Oh my gosh. How scary. How paranoid. How, right?
Yeah.
You can just see what that does to their nervous system, right? Yeah. Turns the sympathetic nervous system right on.
Absolutely.
And it cannot turn off because they don't feel safe in their bodies with everything that's going on.
Yeah.
So when that happens, how can you see in the dark? You can't.
You can't.
Their imagination's off completely. So I say a lot of things like, humor me. I also say, if this were a child, what might they say back to you? If you were to ask your child this question, what would they say back? I allow clients to have this experience without them being fully in body for it. I use the dissociation as a tool to allow them to reprocess what they can.
That makes total sense.
Yep.
Wow, there's so many tools.
Same with empathy. So a lot of clients with emotional neglect and physical neglect lack empathy in adulthood, childhood neglect, especially men. Their emotional systems are just totally turned off, totally underdeveloped and malnourished emotional circuits. Okay. So that being said, a lot of times I'll say, if someone else were to feel this, how do you think they would feel about it? If someone else were to experience this, what might their emotional experience be?
And they can pull
they
it.
Can actually, they can pull it.
Yeah.
They can't pull it for themselves.
Interesting.
But people that lack an emotional, this is so interesting again. People that are incredibly malnourished emotionally, they are hyper attuned to others' experiences around them.
Hyper-focused
hyper-attuned, hyper-focused.
Emotions.
Yep. Hyper-observant of. They've had to be to survive. Because they were neglected.
Yep.
They had to meet the needs of everybody else around them, including their primary caretakers, in order to get their basic needs met. So that being said, anytime someone is emotionally shut off from themselves, they can easily identify, like it's in a textbook, exactly someone else's emotional experience if they were to experience the same thing.
Wow.
So I utilize certain resources and certain phrases.
Yeah.
And I allow someone to be in third person in therapy in order to engage the system and do the work I need to do.
Wow.
To, again, tee them up for EMDR.
Yeah. Okay, so tell us more about EMDR. So in terms of...
Oh, I'm lighting up. God.
So in terms of like people who don't even know what it stands for, one.
Yep.
And just a little bit more about like the science of like how does it work and yeah, anything else you want to share about it?
EMDR is short for an acronym for eye movement desensitization and reprocessing. And what it does is it uses bilateral stimulation, predominantly eye movements. Can they see me?
This is your camera.
Here we go. Oh, okay. So it's this. Okay.
Yeah.
Following with the eyes.
Back and forth.
Back and forth, back and forth. And what that does is it actually allows the brain to reprocess trauma by desensitizing to it and creating new neural networks in place of the traumatized networks to resolve the trauma fully.
Yeah. I think the term you use is reinstall. Is that true?
Yeah.
Okay.
Yep.
I'm trying to get the lingo.
Yeah. So, I turned my energy on, or I turned on my ability to see energy fully. And it was scary and also amazing. I needed to make sure nothing was wrong with me first before I really turned it on. And the fact that I was different has really, again, informed my care. The hard part about grad school is we didn't learn trauma work in grad school.
That's fascinating.
Fascinating.
Because
I know.
your whole practice is, right?
Yeah.
Like that's your love.
Yeah.
Yeah.
So what I did learn is a lot of fantastic stabilization techniques, like CBT,
Yeah.
DBT, ACT,
It's like cognitive behavioral therapy.
dialectical behavioral therapy, acceptance and commitment therapy.
Okay.
There's
To you, that feels topical.
super topical.
Yeah. Yeah.
It's ignoring what happened to us.
Yep.
And trying to just spontaneously resolve the emotional dysfunction inside our bodies by just grinning and bearing it in the current moment, getting out in the sunshine, going on a walk, having a cup of tea,
That feels kind of,
stretching.
yeah, so topical.
It is very topical. And the thing is I actually need all of those techniques to stabilize somebody in the here and now so they feel safe enough to actually go back.
So they're useful. Yeah.
We call it dual awareness in EMDR. I need my clients to have dual awareness. I need them to have one foot in the present. I'm safe here. I'm going back to safety after these 50 minutes to an hour. I have created that for myself. Therefore, I'm confident that I can go back to it after.
Right.
And the other foot in the past, where they can fully engross themselves in this traumatic experience to then utilize that bilateral stimulation and therapy and the EMDR to resolve where it all started. And if we can resolve where it all started, we can further create an ideal sense of safety moving forward. EMDR identifies the cognitions that we tell ourselves and what we learn about ourselves. They are negative from past traumatic experiences. D knows this. Cognitions dictate our emotional response. Our emotional response dictates our behavior or reactions. So you can see that a trauma loop can just continue to spiral.
Forever and ever, amen.
Forever and ever. It is a negative feedback loop. It just keeps spinning downward.
So you have to just interrupt it and then reinstall.
Yes.
I mean, that's gross simplification.
Back to reinstalling. This is great. So what happens then is we take that negative cognition and we pair it with the experience, either the worst one or the first one, in which a client has learned that belief about themselves is fact. Okay. I'm not good enough. I'm not worthy. I can't be trusted. I'm undeserving. I'm nobody.
Yeah.
I'm alone. Okay. Those
are really painful statements.
Tons of them. Tons of them.
Yeah.
And after that traumatic memory is resolved, clients can then look back at that memory and actually reinstall a positive cognition associated with it. Sometimes it's as simple as, I was 5 and I got through it.
Yeah.
I survived.
Right.
It happened. It's no longer happening.
It's almost like a zoom out.
Yes.
Yeah. And the ability to see it differently.
To see it in a larger timeline of, again, past versus present.
Yeah.
Sometimes we even install the most beautiful ones, which is, I am good enough. I am deserving of love. I am lovable. And when we can do that, that's when the whites of the eyes just go boom. Yeah.
Wow. That is just so amazing. Yeah, no, that's nuts. You know, I always say in acupuncture and in Chinese medicine, like in my work, that your body always has your best interests at heart. It's never, ever trying to mess you up. It's never trying to make your life terrible.
Huge.
You know, and so I feel like the system always is trying to help us, right?
Always.
So like the parts are always trying to help us. So even if they're ugly parts, right?
They're trying
or
to
shadow
inform us.
parts.
They're giving us feedback.
Right.
Yep.
And they think they're helping.
Yes.
So it's not like, and tell me if this is, you know it better than I do, but it's like, you never really want to necessarily get rid of parts. You just want to kind of dial back their volumes, turn them up or down, kind of have more of a awareness of like, okay, what is actually happening? But like they're all functioning for our highest good, whether or not they know that you are a, 36-year-old woman. You know what I'm saying?
They're trying their best.
They're trying their best. Yeah.
Yes. And depending on the age of the trauma, sometimes parts think self is a lot younger.
Yeah. Right.
Than
Like big
36.
Self. Yeah.
Big self. Yeah. So we remind the system how old self is. Parts do try their best. And what they think is helpful can also be very hurtful and scary to the system.
Yeah.
The biggest example I can give is I have a lot of clients that come in and say, I want to kill myself today. And we talk to the part that inserts that idea and try to understand where that's coming from. And clients feel so relieved when all they hear from that part is I want to take your pain away.
Yeah. Right.
That's it.
Right. Because they're trying to help.
Yes.
Yeah.
And if we can identify what this part is trying to accomplish with this either dysfunctional belief or dysfunctional or scary behavior, we can understand that parts are so pure.
Yeah.
They just learned a long time ago that the only way to escape the pain is to leave this world.
Yeah.
And then we can identify the age in which they learn that.
Yeah.
And we can identify the negative cognition attached to it, and we jump right into trauma work.
Yeah. So what is it like for you to sit in your pretty pink chair and like hear some of the traumas of the world and to like sit with that, right? Because part of therapy is like, okay, let's be with that. I'd imagine there's some pretty gnarly stuff that you've either sat with, heard. What is it like for you to be in your body and hear all that? Gosh, that's another.
I know. It's a big one. Honestly, it depends on the day. I know what my personal triggers are, and I'm not going to say them because I don't want any of my clients to think they can't share certain things with me. I know what my personal triggers are. Interestingly, my husband does too, because he knows that when I get home and I've heard certain things, it's self-care to the max. It's my own internal family system work. It's my own parts work, meaning my therapist hat gets to come off. I give myself permission to do that. I think what really scared me about graduate school is I felt like I wasn't going to be able to heal people with the type of theories that were given to me and the type of tools and practices that were given to me and the theoretical orientations. When I found out about EMDR, I actually could take that trauma and I could let it leave the room while I stayed in it, and so did the client. And that's what turned me on completely to EMDR is I actually didn't have to hold that trauma. I didn't have to just listen to it.
There was something that you could help do.
Yes. I had the tool that allowed clients to spontaneously heal themselves in session. So I actually feel very riveted when clients are giving me information that might punch in the room, but allows me to say, I'm not afraid of that at all. Let's go with that. Let's work with it. Let's figure it out. Let's take that away from you. You don't have to carry that anymore. So it allowed me to feel very confident and comfortable and energized to work with that. Interestingly, though, depending on the day, depending on my own personal experiences, some days I am more porous than other days, right? And that just makes me human. That actually makes me more like my clients. Thank God for that. I need that. It is so helpful for me to have those days so that I can experience empathy. I can feel humble. I can be attuned to my client's pain when I am also experiencing in my own personal way some degree of suffering. What that tells me is I have to be my own client. I have to increase my self-care. I have to orient to present. I have to create a sense of safety inside my body. I have to trust myself to be able to get through it. And when I can do that, I'm actually reminded of the whole process my clients do with me. And I'm more patient. I take my time. I honor the process instead of trying to fast forward or skip to the good part. Because it ain't always good.
I was having this conversation with my sister about how highly intelligent and like goal-oriented people I think always are focused on results.
Oh my gosh. And
I think part of my life's work is embodiment, just like staying really close to the process and staying really close to like what's here now without trying to like create results, which I think can be really difficult because we just want our patients and clients to feel better. And we also have ideas of how quickly or how we would like
their
that
rate,
to be.
Their pace.
Which I think I find that difficult sometimes. Do you find that difficult?
Hugely difficult.
Because you're like, I can see this, but they have to see it.
And then interestingly, if I am frustrated by their resistance, it just builds more resistance.
Right.
So what I often do is I let the clients work a little harder for themselves in the following session. And that is honestly the medicine to get them remotivated.
So what are the things, like, what are your non-negotiable self-cares? Like, because I'd imagine there's like a repertoire of things that you're like, okay, today I heard a personal trigger, or I really need to take care of myself.
I do EMDR on myself.
Like you sit on tappers, or you can do your eye movements by yourself?
I actually can do bilateral stimulation automatically at this point.
Wow.
My neural networks are primed in a way that can just start that process.
Because you've done all the legwork.
Yes. If it's significant, I will absolutely hook up to tappers. Yes, I will. Tappers, by the way, are like these vibrational paddles that mimic eye movements and that vibrate at different speeds in your palms to create that bilateral stimulation. Showering is really huge for me.
Yeah, makes sense. Water.
That grounding experience. I really enjoy the sensation of kind of water on this area of my body.
You're pointing to your back.
My back and my lower neck. And it creates this level of pressure that I need to ground. Very grounding. I also create boundaries around my level of caretaking for that evening. And I will usually inform my husband ahead of time that I am out. And he is very receptive to that. He's super helpful because he's also seen the other side where if I engage too much, I'm not me. My children do not see me as me. I am either a shell, I am a magnified emotional ball.
Yeah.
Ready. That is just pretty fragile.
That happens for me too, where I feel like a caricature of myself.
Yes, exactly. I'm not me, and my kids know that. There's a level of vacancy there. So I actually talk very little. That is my other self-care. And by engaging with my environment without talking allows me to be wholly engaged in my body and to just meet my moment-to-moment needs. And I genuinely don't know what they are. A lot of times it's a big glass of water, hydration, and nourishment. And I always tell my clients, like, nourishment is food. And I want that food hot.
You'd be surprised by how many people don't know they have to eat and drink.
Yeah. You know what's so interesting is, like, after an EMDR session, your brain needs food.
Yeah.
So I say complex carbs, proteins, whole fats.
Yeah, like your brain did a shit ton of work.
For the next 72 hours, it will be rewriting.
Yeah.
Feed it.
Yeah.
Huge.
And if they don't feed it, does it not integrate as well?
No.
Yeah, that makes all the sense.
No way. I mean, you and I talk about diet all the time, more than exercise.
Yeah, right.
Like, people don't feed themselves. And so I eat a warm meal, and I satiate my body in that way. I hydrate, and I sleep when I'm tired. So I go to bed the moment I'm sleepy, and usually it's a lot earlier on those days than it is on the other days. I just listen to my body.
And what kind of not hard thing to do, but I think there's a lot of barriers to being in our bodies. Do you see that a lot in therapy?
Huge.
Yeah.
Huge. Clients disown their own bodies. They're fearful of being inside it.
Yeah, this leads me to wanting to talk about the way in which our work intersects.
Yay.
Yeah, so actually, backstory for people that don't know this, but Anna and I actually went to kindergarten together. And so we've known each other for a really long time, and we kind of lost touch throughout the years and went our separate ways. And then there was a dinner that occurred where we were both at and we connected. And it was a moment of like, wow, we have a similar vision. You know, we have these ideas about how we want to help and heal, and they were really synergistic. And I feel like that was kind of the catalyst of our work together. And I think that some people who have never either experienced acupuncture or experienced therapy might not have a clue what like the synergy of the work really means. So I want to talk a little bit about that.
Yeah. Me too. Me freaking too.
So tell me what you notice about our synergistic work.
And I want to ask you the same question.
Oh, okay.
After.
Yeah.
I'm so intrigued by like your relationship with our joint work and how you receive it. Because I think how I receive it and how you receive it might be slightly different based on our professions, right?
Yeah.
So, oh boy, Bodywork is instrumental in trauma reprocessing, i.e. emotional reprocessing. We hold emotions in our bodies. And because of that, I need bodies to move.
Yeah.
And the primary way to do that for me, as I see it based on working with you and even before working with you, was acupuncture. It's basically tapping into the body's resources from the neck down, sometimes the brain too, to create a whole person. And depending on the client's needs, acu can be really good right before trauma work, or it's incredible after. It all depends, and Dee will echo this, the subjective nature of the client's symptoms and presenting problems. And I have just noticed, just even yesterday, we had a client that just said that the work that they do with me, when going over to acupuncture, it's almost like a deep tissue of trauma work. It just embeds it further, and it intensifies it in a way that leads to optimal results.
Right. Yeah, for people who don't know like how to schedule it too, I think that what I've noticed is the people who get their bodies kind of go back into fight or flight as they reprocess trauma do really well to come to Acu after therapy.
Yeah.
Because it's there's some really freaking hard work that happens in your room.
Oh my gosh. Yeah.
And when they're able to come over, and I'm not saying that hard work doesn't happen in my room too, but it's in a little different way where it's like, we're really shifting the nervous system from a parasympathetic way to a parasympathetic way. So rest and digest.
Yeah.
And we are asking the body to lay down for 30 minutes plus, maybe even closer to an hour. And in a way, it's kind of a joke because we're like, yeah, take it, right? But it's like, what we're saying is like, integrate.
Yes.
So when this
let it sit.
Let it
marinate.
Yeah. So when the system is in a rest
work.
and digest way, the work, the therapy, the IFS, the EMDR work can stick, I think, and it can, and it sticks regardless. But I mean, like it integrates more rapidly for people who have a hard time being with themselves or dropping in.
Yep.
I think coming to Acu is helpful prior to, and you would be able to tell me if that's true or not.
Yeah, that's right. I would use different language for it.
Yeah.
Sometimes clients need to be elevated in order to do the work.
Yeah. Almost like their energy has to come up to their brain, right?
Yes.
Yeah. And
things got to get moving.
Yeah. Yeah.
In order for them to be engaged in therapy, and Acu works better prior.
Yeah.
To get them in the pocket, I say.
Yeah.
For them to do optimal trauma work.
Yeah.
For a lot of other clients, it's the exact opposite. Like you were saying, is allowing them to kick it up. If they are hyper reactive, just moving through their regular world, let's do trauma work first so that they can rest and digest later. Acu gets them in the pocket.
Yeah. And Anna and I, people who are listening to this that don't know us or our work, it's like we're very intentional about the way in which we work, especially when we know the client is seeing both of us. Like it can sometimes, like I'll speak for myself, it changes what I do sometimes
100%
to support that synergy.
Oh, for sure.
Yeah.
For sure. Sometimes I won't even do trauma work until I ask them when their next Acu session is. Right. If it's not the same day, I need to know it's that week. If not, I actually, I shift my treatment and I make it a little lighter, actually. If I know Acu's just happened or it's coming almost immediately, I can actually ramp it up so much more. And it allows the client to just go so much further in treatment, and healthily so. And they are wholly engaged in it, and they know there's relief, or there's relief that just happened. So their brain is fully online. They can go there.
Now we have, and maybe this doesn't happen very often, but I think it has happened where doing both is too much for a system. And I think that's also important for clients listening, is like to be in touch with that.
Yes.
Of, okay, is it too much to have the two together on the same day?
Yep.
In which case we usually recommend spacing it out, maybe same week.
Yep.
Maybe other week,
Yep.
like therapy one week, Acu the next week.
Yep.
Like,
you know what I've also noticed too is if it's too much for one day, it generally means that clients or patients go to one of us for certain symptoms and go to the other one for entirely different symptoms. And sometimes they don't intersect.
yeah.
And that doesn't mean there's something wrong with our patient or our client at all. It just means that they have multiple and variable symptoms that don't necessarily require two treatments to tackle.
Yeah.
They can be tackled separately.
Right.
And I'm actually entirely okay with that too, because I also think what's very complimentary about it is when you tackle one set of symptoms, it opens up the door for the system to actually identify and be able to resolve the other set of symptoms too, right? We're just knocking them down separately, but together.
Yeah. So overall, what I've noticed is the clients and patients who come to see both of us throughout their duration of treatments get better faster.
Oh my gosh.
That's probably like the number one.
It's so satisfying. No?
It might feel kind of tumultuous.
Oh yeah.
But
they don't know what's going on some of the time.
Yeah, but it's for the purpose of...
And also they trust.
Coming out the other side of like, whoa.
So what's amazing about this is what hits for me is how just how courageous our clients and our patients are.
Yes.
The level of bravery.
Yes.
I cannot...
Because you really have to meet yourself.
Yes.
And that's what our work invites them to do.
It's intense,
right?
This work.
Right.
Too. And we say that to them.
Yes.
You are doing really hard work right now. Your job is to nourish your body and to advocate for yourself in this process. If it's too much, let us know. Usually Dee and I really try to keep pace with that, though. That's really important. If someone leaves my session and comes back and says that was way too much, I view that as a miss for me. And I need to reel in and observe what their ultimate needs are in the here and now. I need to scale back, right? I'm not going to blitz.
Yeah.
Right. And that is really important. Why? Because it's really, really hard for clients to admit that it was too much.
Yeah.
So when they actually say that in therapy, I know that they're feeling very vulnerable and they were feeling some inklings of failure, like they didn't produce. And that also says so much to me about how serious this is. So even though it happens rarely, I highly tune in to that feedback too. I also know too that when clients are doing both, it becomes not too much at all very quickly too.
Right. Agreed.
They're like, whoa, I just feel better. Let's go.
Yep. You're right. You're definitely right. I think it's a joy to collaborate care. I feel like that's always been like the vision in my mind of how to like run a practice and have this collective, right? And it's like an honor to do that work.
Yeah, I'm
with
like
you.
I'm dancing right now. That's what I do when I'm like really feeling something is I start like moving my body.
Yeah.
I can wholeheartedly say the same.
Yeah.
It is such a treat.
Yeah.
A treat.
So for people who are, I'm not going to say naysayers, or the people who are like, therapy's not for me, what do you say?
I say, give it a shot.
Yeah.
Step into my office.
Yeah.
And one of the things that I say too is when clients either, project learned helplessness or it's impossible, it's not for me. I have a variety of sayings that I use.
I love your sayings. There's so many mic drops.
Yeah, like, oh, interesting. Your life's perfect. Oh my gosh. And yet you're sitting in here. Let's talk about how perfect your life is. You don't need help? Okay, let's talk about all the ways that part of you really needs me to know just how secure you are. Let's talk about that. Can I meet that part? So there's that, or I just say, oh, you learned somewhere along the way that no one could ever help you. What happened?
Yeah.
Where did you learn that? And clients are usually like, oh my God.
Yeah.
You're so right. And I said, did you learn that? Or did you figure that out for yourself? Is that something you were born with? Or is that something that someone taught you? And once we can decipher what we learned versus what we know about ourselves, we get to decide if we believe it. And that's a huge thing.
I think the thing that I love the most about you and your work is how direct you are. And it's like, it's a real amazing thing because I think that like some other practitioners, worldwide even, kind of dance around the discomforts or just like maybe don't have the training or maybe,
they don't want to hurt feelings.
Don't want to hurt
maybe
feelings.
They want to be liked.
Exactly. They have their own wounded parts, right? And so I just love that you are so direct in the way that you work. And I think that I am too, and it's not for everybody.
No, it's not.
Yeah.
And I'm also not one to say I'm the be-all, end-all healer.
Yeah.
I just know that what I do works for some people.
Yeah.
And those people tend to find me.
Yeah. Yes.
It allows me to do my best work with the people that want to be there. I also know that clients just want to heal. They want their pain taken away. They don't want to like me.
Yeah. Right.
They don't want a friend.
Yeah.
And if they do, that's clinical, and I flag it.
Yeah.
If they're trying to solicit
Friendship from you.
friendship, huge.
Yeah.
It's clinical. It's a symptom. It's not something that's cute or fun. And clients, again, they just want to feel better. And so if my directness can be hugely supportive in that, we go for it. That's it for me.
Yeah. Yeah. I think about that in my work too. There were many years at the very beginning where I think I wasn't as direct as I am now for so many reasons. And then I just thought, it's a disservice.
It is.
This is a disservice to me and them and the whole practice.
Yeah.
To kind of skate around these uncomfortable issues. And it's like, well, why are they here?
Huge.
Yeah.
Yeah. I also think too, it allows non-complementary relationships in therapy, the therapeutic relationship that is not ideal for them to continue on.
Yeah. Right.
And so if I am myself in the room, then they can know if it's good for them or not. And this is the thing too, is I just want everyone to feel better.
Same. Yeah.
I love when clients are saying, I don't think this is working. Oh my gosh. I usually say, me neither.
Yeah.
I'm usually the one to say it first. So there's
And you're like, thank
progress.
you.
Yes.
You should find somebody else.
Exactly.
And here are referrals to try.
Exactly.
Yeah.
Exactly. This is what I actually think you need. And because of that, let's provide continuity of care for the next 6 weeks until you can get into this person. I care for you so much.
Yeah.
Period.
Yeah. Period. Yeah. You take your ego out of it.
Oh my gosh. Yeah.
Yeah.
Yeah. Because EMDR might not be for everybody.
Right.
I do know that Dee and I have a really great client base where a lot of the times people come knowing full well what we do and how we do it. And that can be really helpful for buy-in and motivation for their own work.
Absolutely. Is there anything that I didn't ask you that you want to talk about?
Yes.
That you think is...
Just one thing.
I love asking that question.
Yeah. To back up what we've been talking about with acu and psychotherapy is there's loads of research on bodywork when it comes to trauma treatment, and it comes to PTSD and other trauma-related disorders, as well as trauma-based disorders like personality disorders, huge ones. Anxiety and depression and OCD can actually have a trauma component as well. When I work from a trauma framework, that is what I look for. What has forever changed the way you see yourself, the way you see other people, the way you see the world around you, and how you relate to it? If we can identify those events and those people that did that to us, that forever altered our own ego landscape, that's it. That's all we need to be able to resolve the negative cognitions we learned to then install the positive cognitions. Huge. What's important about bodywork is all of the emotions are kept in the body. And so there's this amazing neuroscientist and psychiatrist named Bessel van der Kolk who wrote The Body Keeps the Score. Highly recommend.
Great book.
Anyone read that.
Great book.
Yes. He is amazing. That book is amazing. It will stand the test of time because it hones in on the very fact that how we have moved through this world, whether we consented to or not, these personal experiences, whether they were given to us or not, forever changes how we see ourselves in the here and now. And that being said, body movement is so critical, whether that be internal through acupoints and needles, or yoga,
Just
or
moving your body.
moving that freaking body. One of the biggest things that Bessel has created is a Shakespearean theater group for anyone that has entered the juvenile delinquent system in his town that he lives.
That's cool.
Yeah. So again, he taps into IFS too. Play a different part. See what comes forward for you. See what you get to let go of in that process.
Wow.
Be an actor in your own life.
Yeah.
Huge results. Yes.
Wow. So for the people who think through like trauma work and therapy that there has to be some type of like confrontation with the people who wronged them. I feel like a lot of people fear doing therapy work, some people, because they think like, oh yeah, now I'm going to have to like confront my mother.
That brings pain to my heart.
Yeah. So what do you say to somebody who's like, oh, I don't want to like, or I don't want to go to therapy because of that?
I would ask them what that part wants to accomplish
by having that conversation.
In challenging their perpetrator or confronting them. Mm-hmm. And I can tell you right now, all that part wants is validation. Mm-hmm. Yeah. And I say, well, why can't self do that for you?
Yeah. Yeah, we have these ideas where, and this is true, where we kind of have to reprocess and kind of walk through some of the dark to get to that light.
Yes.
And that can be a really scary, scary thing. Mm-hmm. And I think it doesn't always have to involve a confrontation with
an environmental,
the perpetrators.
External one. No.
Yeah.
It can be all internal.
Yeah.
That's why EMDR is so beneficial.
Yeah.
And works so well, is it allows you to go into the body to resolve all of it.
Yeah.
In addition to IFS. So we allow self to go into the body to find the memory where that part is stuck and exiled, and to be the caretaker that part never had. So once we can identify self as the most kind, compassionate, most safe caretaker we'll ever need, we are literally our own healers.
Yes.
It gives us this sense of control.
Yep.
And emphasizes that we can do it all by ourselves. I call it riding the bike. The moment I tell my clients they're riding their own bike, they're like, oh my God.
Yeah. Yeah, it's the same like you are the medicine. Like we have all the goods.
And you believe that too. I know you do.
Yeah, we have all the goods inside to heal ourselves, but we're taught through societal norms and patriarchy and capitalism and that, you know, we need something external to us to heal.
To fix the defectiveness.
Yeah.
Yep. Nope.
Yep.
And that's why prognosis to me for therapy is always so fucking good.
Yeah.
So good.
Yeah.
I believe that anyone has the power to heal their own bodies.
Yeah.
They can do it.
Yes.
Yep.
Okay. This is my final question.
Okay.
Okay.
As our spaceships are ascending.
Yeah. Our spaceships are like, ooh, we're going to the moon. Okay. It's 30 years down the line.
Oh my
Anna,
gosh.
you are retired. You just retired. Okay. What do you want the world to know about your life's work?
That I helped someone find their path to healing. That's it. Someone.
My heart
I
is
don't
like
want
singing.
fame. I don't need accolades. I need to know that in those four walls, somebody healed themselves and saved their own lives. That's it.
God, I love you.
I love you.
Oh my God.
That's it.
We are so fortunate to have you enlighten us, speak to us, heal with us. Like, thank you so much for being here and for gifting us with your presence and with all the information that you shared.
Thank you for having me.
Yeah.
Maybe one day I can interview you on the Good Good.
Oh my God. Yeah.
Maybe I can do that.
Oh my God.
Because
you can do that anytime.
Let's do it.
Oh my God.
How much time do we have?
I know, right?
But I think, you know, one of my greatest and most successful leaps is doing this with you.
Oh.
Because I didn't have to come home.
I know.
I went away for a long time.
Yeah.
I had zero intention to come home until I met you.
Oh my God. Wow. Wow.
And it has freaking paid off for
Yeah.
us just in our own personal
Yes.
and professional growth and where we want to take this.
Yeah.
Huge.
I feel the
Yes.
exact same way.
We call it a collective for a reason. This is only going to grow.
Yeah.
Fertile ground over here.
Yeah.
Let's go.
This is only the beginning.
Yeah.
Now we're both like,
Yeah.
oh my gosh.
Thank you so much for having
Oh,
me.
thank
You
you.
are perfect.
Oh, thank you. You know what? I was going to ask you, what is my aura right now?
Your aura?
Like,
Oh
and
my
does it
gosh.
happen? Is it like you see it and you're like, there it is? Or is it like gradual?
It's gradual.
Oh,
It's
okay.
gradual. It's a mix between like a greenish and a yellow. So I'm pointing at her heart right now.
Yeah.
She's pendulating between, what is it? Green heart and then closer to sternum, right? Yeah.
I knew you were going to say green.
Yeah. Green. It's like you've got, you're flirting right in the dead center of your body.
Yeah.
It's really cool. Yeah.
You know, something about being on this, like, and interviewing people causes me to be like,
Yeah.
like,
Yeah. Because you and I are naturally elevated. You and I both know this.
totally.
Yeah. And we love sitting lower energetically, but we
tendency is
naturally,
always,
elevation for sure. We have a lot of energy. We like to expose that energy. We like to put it forth through impact in our, immediate and larger surroundings. And Dee and I often, actually, I don't want to speak for you. I often have to catch myself because
me too.
it's big time.
Me too.
And so anytime Dee and I notice that we ourselves are floating lower, we're grounded, we feel like being barefoot in sessions, that's a good sign for us. We're moving a little bit more slowly. We're like in our pocket.
I also notice it in like my voice, like the way that I like drop in.
Yes.
Yeah.
Can you see my aura?
I don't. So the way that I experience energy is different. So I don't see color aura, but I can just. It's a sense felt thing.
Yeah.
So I can pick up on different things. It's like sometimes it's random, sometimes it's emotion, sometimes it's people.
Yeah.
Which that and that
yeah.
was like I feel crazy.
Yeah.
When I was like, okay, who's that woman? Like she's not here.
Oh yeah.
Right?
Oh, yeah.
Like you're like, okay.
That's when it gets real weird. And
Yes.
Dee and I both have that too. So when I
Yes.
turned on all of that other stuff, I started seeing dead people.
Yes. Yes.
And I've started working with them and talking to them, and they enter the room. My clients bring in their deceased loved ones.
Yeah. Yeah.
And sometimes not loved ones.
Yeah.
And we work through that.
Yeah. For me too, I sometimes get like it's senses. So sometimes, and a lot of times it comes through visual. Like I'll see a picture of something, or I will see like even feeling the way the energy waves move. Like sometimes it's fast and sometimes it's slow, or
Yes.
like waves of an ocean. And
Yes.
I feel like sometimes I can't cognitively make sense of it necessarily, but that's not the point. I think it's just to like present the picture and it hits. It usually hits. Like
It's usually correct. Is
it's
what
usually
you're saying.
correct.
There's an
Sometimes I don't
accuracy.
always share it.
Yeah.
Yeah.
Right. Oh, same.
Yeah.
It just informs.
Right.
Right.
Yeah.
Depending on what the client can hold in that moment,
Yes.
it's too much.
Yes.
But it absolutely informs how I relate to them and my care moving forward in that next 50 minutes.
Absolutely.
Huge.
Yeah. I've had people be like, "Can you read my mind?" And I'm like, "No, that is not how that works." Like it's more of just like of a really deep knowing.
You hear what their body says.
Exactly. Which jarred me when it first started because
Same.
it's the communication comes through my system. So like I thought that I was experiencing it firsthand. So if I got like a sensation, I'd be like,
Yeah. Yeah.
am I okay?
Yeah.
And then I'd be like, oh, this isn't for me. Whew. Okay.
Yeah. Right. It's not mine.
It's not mine. Yeah.
So then we give it permission to leave our bodies, but we get to look at it.
Yes.
We're like,
yes.
okay. Yeah.
Interesting.
Yes.
Interesting information.
Yes.
Yeah. Okay, well, thank you so much for being
Thanks for
here.
having me.
Yeah. Thank you so much for joining us. I just want to take a moment to talk to you about Ember and Root. So Anna predominantly works with adolescents, at least 16 plus adults and couples. Meanwhile, her associate Jalen works with children, adolescents, and young adults. There's currently a wait list for Anna. So if you or somebody you know needs therapy, reach out. Also, Anna is a curator of a wellness boutique that is also in our office, and it's a really beautiful space with lots of her favorite things. And there's some free people movement in there, and there's some really nice jewelry and candles and other products to check out. And just a bit of a humble brag, anybody who hasn't been in to see our beautiful, lovely office, I definitely encourage you to do that. We've both spent a lot of time creating the office space and making it a really safe, conducive place for healing that appeals to all the senses, as we talked about. We're really proud of the space. And so if you haven't had a chance to check us out, definitely do so. We are located at 76 Margaret Street in Plattsburgh. So thank you so much for joining us, and I will catch you in the next episode.